Welcome back to In Depth with Academia. I'm Richard Price, CEO of academia.edu, and today we've got a really, I think, fascinating topic to dive into together. We're looking at a paper by Michael Uebel titled Anger in the Therapeutic Space, Healing Through the Attitude of Equanimity. And remember, as always, I'm here to break down these ideas, but my goal is to present the paper neutrally, not to endorse or refute it, more just open up these academic concepts so you can reflect and form your own thoughts. So what's the core issue Michael Uebel is dealing with in this paper? It's actually a question that feels very close to home for a lot of people, which is how should we understand and navigate anger, especially inside the therapeutic setting? Anger shows up in all our lives, and in therapy, it's not the fact of the anger itself that's the problem, according to Uebel anyway, but rather it's our relationship to that anger. So why is that significant? Well, anger isn't just this big, negative, scary emotion to suppress or get rid of, right? It's a normal human thing. But the ways we respond to our own anger, or our patient's anger if you're working in therapy, can literally change the course of psychological healing. That's a pretty big deal, honestly. Let's get into some of the key arguments Uebel makes. One thing he does early on is bring together Western psychodynamic thinking and Buddhist philosophy, kind of an unusual combination, but it makes for some intriguing insights. From the psychodynamic angle, anger is, seen as a way people try to deal with tough emotions like fear or shame, or even a way to get back a sense of control after something hurtful happens. It can actually be kind of constructive, like think of anger propelling social movements. But on the flip side, anger can also show up as a defense mechanism, protecting us from feeling vulnerable or as a reaction to traumatic events. So there's this duality, right? It's not all bad, not all good. That's just kind of, it's life, isn't it? But here's where it gets interesting. Uebel draws in Buddhist ideas, and particularly the concept of equanimity. What's that? Equanimity is kind of this mental attitude where you're open and balanced toward whatever's happening. No, not grabbing onto one feeling or pushing another away. It's a little abstract, but the practical upshot is that when anger pops up, instead of being swept along or trying to squash it, you sort of step back and notice what's happening, maybe even with a bit of curiosity or gentleness, kind of like, wow, look at that, I'm really furious right now. And again, just to underline, I'm not saying you should try all this or that it's the answer. I'm just walking you through Uebel's neutral presentation, not my own advice. Anyway, so back to the methods. Uebel isn't doing original experiments here. This is more of a reflective paper drawing on clinical experience, established research, and Buddhist literature. He looks at how anger operates in therapy, not just for the patient, but also for the therapist. Anger can show up along with guilt, shame, even clinical disorders like depression or PTSD. It gets complicated fast. Now, where does equanimity fit it in? According to Uebel, cultivating this neutral, spacious attitude, equanimity, allows patients, and maybe therapists too, to relate to anger more flexibly, with less tunnel vision. Instead of reacting automatically, or just shoving anger away, you create space to observe, and to choose your response. It's like breaking out of an emotional echo chamber, if that makes sense. There's this Zen story Uebel shares about a samurai who became a monk. The guy used to react with violence when insulted, but after training in equanimity, he gets spat on, and instead of lashing out, he wipes his face and feels grateful for what he's learned. Kind of poetic, huh? Honestly, it reminds me of that old saying about counting to 10 before responding to someone who upsets you. Except here, it's like a whole way of seeing the world. Also, and I have to mention, Uebel doesn't claim that equanimity means you stop feeling things. You don't become a robot. Instead, anger and other emotions are allowed to exist, but you're not dominated by them. So, what does this really mean for you, listening out there? Maybe it's just food for thought. Maybe the next time you're furious about something, instead of squashing it or letting it explode, you ask, can I meet this with a little more openness? Or maybe not. It's all about exploration, not prescription, quick digression. It's funny. This stuff about equanimity, I once tried meditating after reading a book on mindfulness, and wow, my mind just ran straight to what's for dinner. So, we're all works in progress. As we wrap up, I really want to highlight academic work, like Uebel's, isn't absolute truth. It's more like a lens you can look through, try on, and see what you think. Maybe the idea of equanimity resonates with you. Maybe you're skeptical. That's perfect. Academia is about opening up possibilities, not shutting them down. So, thanks for joining me today for this kind of unusually peaceful episode of In Depth with Academia. Don't forget, I'm Richard Price, and I can't wait to keep exploring more academic conversations with you next time. Take care and maybe experiment with a little equanimity. You never know.